Good afternoon. Welcome, everyone. Thanks for joining us today for this webinar. Um, would like to welcome all of our attendees. We know some folks are still getting logged in, but we'd like to get started right at 12. And just as a reminder to everyone, we will be recording this webinar so that we can get this uploaded and so that others can view this at a later time. So please note that it will be uploaded to belong.utah.edu. So if you have other questions or want to revisit the webinar, you can sure do that at that website. We're excited to have you all here today for today's topic, where we will be talking about understanding healthcare coverage on campus. My name is Brittany Badger, and I serve as the director for the Center for Campus Wellness here, and I'll be moderating the webinar today with our wonderful panel. And to introduce our presenters today, and then we will go ahead and get started. Today we have two representatives from the Student Health Center. We have Jillian King, and we also have Dr. Mark Fitzner. And then we also have Dr. Sheree Watkins, who is the AVP of Student Affairs Health and Wellness. And they will be sharing a little bit more with our group today on healthcare coverage on campus. And just a little bit about the run of show. We will be doing about a 40-minute presentation with our presenters today, and we will have time for Q&A. So if you have questions, please know that we will have time. You also have access on the webinar where you can upload your questions through the Q&A chat box. And so you're welcome to share that there as well. And we will answer those as we can towards the end. And other than that, we're excited to get started. And I believe that Jillian, are you going to be starting today? And Jillian serves as the Associate Director over Finance in the Student Health Center. And I will turn it over to our presenters.
Perfect. Thank you so much, Brittany. I appreciate it. So yes, welcome to our webinar. Today we are talking about, as we mentioned, understanding healthcare coverage on campus. This ends up being a topic that our students and our students' parents end up having a lot of questions about. So we're hoping to clarify some different issues and just make sure that you are feeling well prepared to be a new student on campus or to send your students to campus. So one thing that we get asked quite frequently is, what should my student be bringing to campus? So a lot of parents take time to choose the right school, look at different academics, make sure they've got the right laptop and things like that. And unfortunately, the health piece tends to be forgotten quite frequently. So I've got a list here of items that we recommend that you send with your student to campus if they are moving away for school. So the first thing is a health summary. Being able to know what any kind of conditions your student has, what medications they have, allergies that they're dealing with, makes it so much easier for them to establish care with a new provider near or on campus and get the best care possible. So you'll want to make sure that as you send them, you do include all of their records, including their immunization records. FYI, none of our doctors want to read every single well child visit that your child had from the time that they were born until they were 18 and went off to college, but we are looking for the pertinent information. So if we're looking at any kind of chronic issues, things that require medication, those kinds of conditions, please, please, please make sure that your child is informed on them and that they have documentation of that. Proof of insurance. So that's going to be a big topic in our presentation today, and we're going to dig into that a little bit more as we go forward. But the basic is that your child should have a copy of their insurance card, however they are insured, whether it's through you, if they've got the student health insurance. We'll talk about that a little bit more in a moment. But they need to know what their insurance is and have that proof of insurance with them. And you'll also want to educate your student, your child, on how their insurance works. The next slide, we'll go over a little bit more the specifics that we would recommend that they know, but you want to make sure that that's a conversation that you have with your child. First aid kit for small emergencies. It's surprising how often people don't think about this, but throughout your life, you just normal day-to-day, you run into cuts and scrapes and different kinds of issues. So make sure that you are packing a first aid kit for your child. We're just looking for the basics here. So bandages, some kind of an antibacterial ointment, a thermometer so they know if they have a fever. You'd be surprised how many calls we get to the student health center of folks wondering if they should come in because they think they have a fever and they don't actually have a thermometer to check if they do. So make sure that that's with them. And then your normal kind of over-the-counter medicines like acetaminophen, ibuprofen, whatever works well for your kid. And then masks for illness, because we do obviously want to make sure we're also preventing the spread of any kind of illness. So understanding your insurance. I know that we have this conversation frequently with students as well as with their parents because surprise, insurance is complicated and there's a lot of us that always don't understand all the different ins and outs. So the basics that you're going to want to make sure that your child knows before they need to use their insurance is they need to know what their insurance is, like I mentioned on the last slide. And then you want them to be able to know who their in-network providers are. So the best thing for them to do is to call the insurance and get an actual list of in-network providers. A lot of insurance companies will also have this online in a pretty easy format to search, but you'll want to see what is closest to the campus, closest to where they're living, that they know if they have strep, if they get hurt, if they have a question about something, they know what doctor's office to call to go and get an appointment at. So when you are looking at in-network providers, you're going to see a lot of insurances have separate tiers with those providers. And it's your preferred providers most of the time is the language you'll see where you want to go, because that will most likely be your highest coverage. But that's also a question for your insurance when you're looking at who is in network. Where is that highest tier or highest coverage so you have less out of pocket? When we are looking at the coverage itself, this is where there's often a lot of confusion. So you want to make sure that you understand and your student understands what your coverage is. So I've listed a few phrases here that I think are nice for us to go over quickly and make sure that there is no confusion on the definitions. So your deductible, that's the amount that you are responsible for before your insurance starts to pay. A lot of plans have a deductible set that you need to pay that amount out of pocket before the insurance starts covering your actual visits. There are some differences with Affordable Care Act guidelines where, you know, different things are still covered 100% outside of that deductible. Talk to your insurance and make sure that you understand when that kicks in. Copay versus coinsurance. So these two words are used interchangeably sometimes, but they do mean different things. So a copay is a set amount that you are responsible for paying when you go to a visit. So if you are going to see a specialist and you have a $35 copay for your specialist visit, that means you are paying $35 up front and the rest of it is covered by your insurance. With coinsurance, that's more of a price sharing model with your insurance company. So you're going to be looking at a percentage. So instead of a set flat fee, you are responsible for a percentage, whether it be 10%, 20%, whatever your insurance has set that to, and then the rest of it is picked up by your insurance. That coinsurance amount is going to be set on the actual negotiated price that is in the contract between the insurance company and the provider. And so you'll want to wait to see the bill from your insurance to know what that percentage is, because it's generally a little bit lower than the amount that the provider sends in. Preventative care versus problem visit. So we get this question in our clinic very, very frequently. So preventative care under the Affordable Care Act is covered 100%. So with a preventative care visit, you are not going to see that copay amount applied. A problem visit is when you're actually sick, concerned, there's an issue going on that you're going to be seen for. So if you are just coming in for a regular well check, you want to do your yearly annual exam, that most likely is going to be a preventative care. As soon as you come in and start talking about a problem, I have chronic headaches, I have depression, I have these different things going on, that's considered a problem visit, and there's most likely a copay applied. So just wanted to kind of clarify a few of those terms because they are helpful to know as you navigate health insurance and health coverage, honestly, anywhere in the United States. So we've got an idea then of coverage, what your student should be bringing, and now we want to look at where is your student going, what's closest to campus. So the Student Health Center, where Dr. Fitzner and I work, is on the first level of the Madsen Health Center, which is on campus. We are at the corner of Mario Capecchi and Foothill Drive, and we are open to see any students and their dependents who are eligibly enrolled for the semester. One thing to keep in mind with the Student Health Center is that we are here specifically to serve the students, and we are dealing with a constraint on space. And so we are only in network with the student health insurance plan, which I'll go into a little bit more here in a minute, as well as our Wellfleet plan that is administered through Utah Global. So if you are with one of those plans, the Student Health Center is definitely where you want to start. We are still open to other students, but it is at an out-of-pocket cost, and so we don't bill other insurances. What is nice, though, is that we are able to get folks in usually a lot sooner than other different clinics. So we are happy to see you if you've got something going on that you want to be seen kind of on a faster timeline for. And we are able to have highly reduced rates compared to the rest of the community because we are funded by student fees. So we are a great option, but maybe not the first option if you have private insurance. So that's something to keep in mind. University of Utah Health is a world-class, amazing healthcare group. Obviously, we're going to be biased because they're part of the University of Utah, but they are a research and teaching hospital that is on campus, as well as they have community clinics around the area. So they do anything from primary care to specialty services. Honestly, it's pretty hard to stump these guys if you are looking for someone for a specific issue. And they are also very accessible since we've got the University of Utah Hospital on campus. We have outpatient clinics on campus. The Madsen Health Center, where we are located, is part of University of Utah Health. So the top two levels are clinics with them. So if your insurance covers at University of Utah Health, I would highly recommend that you go there. In Salt Lake City, and the Salt Lake Valley, we are fortunate to have not one world-class medical organization, but two. So Intermountain Health is the other big player in the Valley. They are a not-for-profit healthcare system, and they provide exceptional care. So you will see with most insurances, you will be covered at either University of Utah Health or Intermountain Health, which is why you definitely want to check with your health insurance before you're sending your student to one of these clinics, so you know which one is going to provide you the best coverage. So they have clinics and hospitals across the Intermountain West. Those of you coming from out of state might see them popping into Nevada and Idaho, so that you might already be familiar with their system. Other options, we do have the Mountain Star Hospital System. If that is what your insurance covers, there are several different Mountain Star locations around the Valley, as well as a plethora of private practices. So I know I've said this a lot, but you'd be surprised how often we say it and we still get questions. Please, please, please check with your health insurance carrier and make sure that whichever clinic you're choosing is the one that's in network for you, because we want to make sure that it's as seamless for you as possible, and also that you're not incurring unnecessary costs. All right, so the Student Health Center, I've got our QR code up on here so that you can pull up our website if that's more convenient. As I mentioned, we're on the corner of Foothill Drive and Mario Capecchi. Our technical address is 555 Foothill Drive. We are open Monday through Friday, and we are by appointment only. So please make sure that you are calling to make an appointment or making an appointment online. Both options are wonderful. If you do not see the appointment type online that you want to be seen for, make sure that you give us a call, and we want to make sure that you are scheduled appropriately so that you have the amount of time that you need for your visit. Tuesday evenings, we do have extended hours, so we were open until 7:30 p.m., which is just a little flexibility for those who have difficult schedules. And we do also have telehealth options available. So I mentioned that we were going to get a little bit more into the Student Health Center, just so you get a better idea of what we offer and the different services that you can receive here. So we are a primary care clinic for students, spouses, and dependents. So that is, we are available to take sick and well care appointments. And then if there's ever anything that you are coming to see us for that turns out to be a little more specialized, we will make those referrals as necessary. We do have in-house sports medicine and travel medicine that you can be referred to by our primary care physicians if that is what you're looking for. A lot of our students will see us specifically for immunizations. So we do have an immunization requirement on campus. You have to have your MMR according to our standards that are set out by the CDC. And so you can come here to receive that MMR or to do a titer to prove that MMR, but we are happy to kind of guide your students through that immunization process. So a lot of the questions we get are specifically about our student health insurance. So I'm going to talk about that for just a moment here. So our student health insurance is administered by United Healthcare Student Resources. It is fully Affordable Health Care Act compliant at a gold level. And we've got our website here listed so that you can look up the actual policy and see what the coverage looks like so that you can determine if it's right for your student. So our open enrollment with the student health insurance plan is at the beginning of every semester. The fall open enrollment has actually ended, but you can take a look at that and see if it makes sense to sign up for your student in the spring semester, but you can also enroll if you have a qualifying life event. So if something happens that your student has been insured under your health insurance through your employer, and then your employment changes and that's no longer available, that's considered a qualifying life event. They can go on, fill out a form, and sign up for that insurance at that time, if that makes sense. Within the Madsen Health Center, we are fortunate to have a pharmacy and radiology on site. So when you come to the student health insurance or the student health center, sorry about that, you are able to access those services as necessary based on your needs for your visit. Quick look at our website here. So our Student Health Center website, we've got a few different little buttons here that you can go to look at our different services, get more information about insurance. Maybe three buttons that you're going to be most interested in is our appointments button. So that allows you to schedule appointments online. Immunization requirements, that goes over what is required for you to be a student at the University of Utah as far as immunizations go, and then our patient portal. So our patient portal gives you access to messaging our doctors here, looking at your appointments, putting in information regarding your immunizations, uploading documents. I want to note that although we are on the same campus as the University of Utah Health, we are a separate organization. We are part of Student Affairs and not part of University Health. And so we do not use Epic and we do not use MyChart. So if you are going on MyChart to try and message the doctors at Student Health, you will not be able to find them. You'll want to go through this patient portal right here on our Student Health website. So if something happens and your student needs to get care quickly, we want to make sure that you're aware of your options. So as I mentioned earlier, the Student Health Center is by appointment only. We are not in urgent care and we aren't set up to take urgent needs. And so we would recommend that based on your insurance coverage, you hit one of these three options. If it is, a serious emergency that we are looking at immediate intervention, the emergency department at the University of Utah Hospital is wonderful and available to them and right on campus. So if there is an emergency where you need to go to the hospital, that is where you'd want them to go. If we are looking at something like flu, strep throat, something that would take you to an urgent care situation, the two closest to campus are the Instacare at the Intermountain Health Salt Lake Clinic. That is right on the TRAX line, which is super convenient. So it's on the corner of 4th South and 9th East. So you can take TRAX from campus to that location. And then there is the urgent care at Sugar House Health Center. That is a University of Utah Health location, and that is down 13th East and just a little bit past 21st South. That is on a bus line, but not on our tracks line. Once again, check your insurance. Most likely you will be covered at either Intermountain Health or University Health, probably not both. So you'll want to make sure that you are sending your student to the one where the coverage is, if that is a concern of yours. So transferring pharmacy prescriptions. A lot of our students come to the University of Utah with existing prescriptions, and especially if they're coming from out of state or at least out of the area, they have questions about how to make sure they're able to receive those prescriptions when they are here as a student. So you can request that your prescriptions be transferred by calling the new pharmacy that you want to go to here in Salt Lake and giving them the information to initiate that transfer request with your existing pharmacy. So you will want to make sure that you have all of your pharmacy details, phone number, address, anything that they might be asking for, as well as the prescription details and prescription numbers. So make sure that that is all available before calling to make that transfer. So that works for most prescriptions, but there are some controlled substances that have different rules on what is allowed to be transferred and how that works. Your pharmacist will be able to guide you through all of that. But what we see most often is questions on ADHD medications. So those cannot be transferred across state lines. You will need to establish care with a Utah medical provider in order to continue receiving that medication. What I would recommend is that you have all of your information regarding your ADHD treatment and diagnosis to take to that new Utah medical provider. Most physicians will require a diagnosis of ADHD from a psychology specialist before prescribing that. And so if you already have that all together from your previous provider, that does make the whole process a lot more seamless. When we talk about vaccinations, I did mention obviously the Student Health Center does vaccinations, but keep in mind that so do most pharmacies. And what's nice about that is a lot of pharmacy benefits do cover vaccinations. And so it's easy for students to go in to your Walgreens, to your CVS, whatever pharmacy you decide to use, and get things like your flu shots. If you're behind on your MMR, if you're looking for a COVID vaccination, things like that, a pharmacy is a great option. You'll want to check with the pharmacy that you use to see if they need an appointment for those visits before you go in. But those, like I said, are generally covered under your pharmacy benefit. You have heard my voice a lot through this, but we would love to open this up for any questions that y'all might have. So feel free to put those in the chat, and my colleagues and I are happy to answer those. Brittany, also, if there was any clarification that you needed as we were going through, we're happy to hit those areas as well.
Wonderful. Thank you, Jillian, for presenting all that really helpful information. I know that healthcare coverage, especially for our students, can feel a little complicated. So if anyone has any questions, you are welcome to share those now. Our presenters are happy to answer anything that you have. And while we maybe are thinking about what questions we might have, there was one that was in the Q&A where one of our attendees asked if we would be sending the presentation slide deck out. And yes, we will make sure that is shared with everyone. And again, this entire webinar will be uploaded to the belong.utah.edu website, so you can come back and visit it at any time. And looks like we have lots of questions. So I'll kind of read these out, and if our panelists can help, our presenters can help us to answer these. So we have one of our attendees asking, which of the urgent care locations are covered by the university health insurance? Jillian or Mark, could you help us answer that one?
Yeah, so if you're looking at, it depends on what you mean by University of Utah health insurance. So University of Utah does have their own health insurance that they offer, in which case you would want to go to the Sugar House location. That's where you're going to get your best coverage because it is a University of Utah health location. If you are looking at the student health insurance, then that you have the option of either. So we do have an agreement with the Salt Lake Intermountain location that there is a $50 copay for any of our students with student health insurance who go there. The one thing that you want to be aware of is that that is for folks who are going when we are not open, so after hours. Mark, I don't know if there's anything that you would add to that.
No, it's and then so you mentioned the university offers a plan, then there's the employee plan, which I'm pretty sure usually the best deal is through University of Utah. Yeah, and I think for the most part, urgent care is well covered. I would say too, I know many families have Kaiser insurance if they're from California, and Kaiser typically the only coverage they have is for urgent care. So I have not checked their website for sure, but I would assume that any of the urgent cares would be covered by Kaiser.
Wonderful, thank you. And we have another question from Alice, and they're asking, how long is it to get an appointment at the Student Health Center currently?
So it'll depend on what you're being seen for. If you want to see one of our healthcare providers for a visit, then you are looking at 1 to 2 day wait. It's pretty fast to get in. If you want to come in and see one of our nurses for a vaccination or lab appointment, those right now are a little bit farther out because we are at the beginning of the semester when everyone is coming in to get that immunization requirement taken care of. And so you might be looking at a week or 2 for that. That's not our standard wait time. Usually we can do same day or next day with our nurse appointments, but the beginning of the semester does tend to get a little wild.
And Jillian, I might also include too, I mean, there's certain times of the year where we get very busy, and so the appointment times can be out for providers. But if they're on the student health insurance plan, they also have the option for telehealth visits through the insurance company that's covered at 100%. They don't have to pay anything for those visits. And then students not on the plan, I think they're $40 for those visits. So it's additional providers that are available outside of what we have. And information about that is on the website.
Wonderful, thank you. We have a couple more in here. So we have another question. So Jillian, you had mentioned talking about insurance, and the question in here says, you mentioned state of Utah insurance. Do you know if we can get that congruently with something like Covered California? Oh, and possibly thinking about maybe it's with the student health insurance, can you get that in addition to the Covered California?
So you would want to double check with your provider. I can't speak fully to what other states do. I know that California offers plans as a state. The only state offered plan that Utah has is our Utah Medicaid. So that is need-based. And so you'd have to show a financial need in order to receive that. I can talk in generalities though. So most of the time you are perfectly fine to have more than one health insurance coverage. What you'll be looking at then is an order of a filing order. So you want to know what your primary is versus what your secondary insurance is. If the student health insurance is under the student's name and then the other insurance is under the parent's name, it should be that your primary filing order would be the student's insurance first, so the student health insurance plan. It is fine to add that on and make sure that they have that in addition to the coverage they already have with you, but you will want to talk to your insurance company and make sure that they have all the information and that there's no issues with that filing order, because the last thing you want to do is think that one insurance is your primary and the other is your secondary and have your insurances think that that's swapped. So you just want to make sure there's full communication with your current insurance so that that works well.
I'm kind of just bouncing around a little bit in the Q&A here. Just to go back really quickly on the urgent care question. So for urgent care, one of the attendees is asking, do you not make an appointment with the student health center and instead go to Intermountain? And I think you kind of were talking about how there's a couple Instacare options that are nearby. Do you mind maybe just kind of re-sharing that information for our attendees? Because I know that can be a little complicated, especially if you're from out of state and aren't as familiar with our healthcare options here.
For sure. So When you're going to be utilizing urgent care is when it's something that is unplanned and urgent. So if you are experiencing a severe sore throat and you want to be seen right away and make sure that you know whether or not it's strep and if you have to get on treatment, you probably don't want to wait for an appointment for that. That's something that you'd go to urgent care for. If it's something that you can plan ahead of time, you know, you've been having chronic headaches. This isn't a new severe onset. This is something that has been happening continuously. You'd want to set an appointment and come in to see us. Mark, I don't know if you want to add any more detail to that of when you should be setting an appointment versus when you should be going to urgent care.
I mean, I guess it depends what people's definition of urgency is. So I think obviously if it's something, especially in the evening hours when we're closed, urgent care is kind of the option to go to if you need to be seen. But if during the day, you're always more than welcome to call the student health center if you're not, especially if they're not sure. And our receptionist oftentimes will transfer students, if we don't have appointments, to one of our nurses, and the nurses will talk to them and then help them decide whether it can wait to be seen in our office in the next couple of days, or if it's something that they should go to urgent care or not.
Right. And as Mark mentioned earlier, obviously throughout the year, our availability kind of varies based on how busy we are. If you have the student health insurance plan specifically, I would always call the student health center first, unless it is a life-threatening emergency, then please go to the emergency room. But if you call us first, we can see if we can fit you in that day. Sometimes we have cancellations, different things happen. And as far as insurance coverage goes with the student health insurance plan, it's a lot easier if you're seen here. So call us, talk to our nurses. They're really friendly, and we're happy to give you the best advice we can of what you should be dealing with that day.
Wonderful. Thanks, Jillian and Mark. We have a couple more questions. I did want to just interject my own question and just wanted to throw this out to Dr. Watkins, but Dr. Fitzner and Jillian, you were welcome to chime in on this as well. Healthcare insurance and terminology is really complicated, I think, for any adult. And we always have lots of questions. And so I often think about how confusing and overwhelming it might feel for our students who are just starting to navigate that. And so maybe to start with you, Dr. Watkins, if you have any suggestions or strategies on, ways that our attendees and families can help support their students in maybe building some of those health literacy skills surrounding healthcare, insurance, coverage, all of that.
Sure. Some of the basics, I think, have previously been mentioned by Jillian, but just as a repeat, number one, helping them to understand what are their own needs and also conditions is going to be very important. I know sometimes based off of geographical locations, we sometimes say the actual term for chronic diseases, and sometimes we may use colloquialisms. So I'm from North Carolina. If you can hear the twang, we sometimes say sugar, diabetes, or sugar. And it's actually diabetes and hypertension and those types of terms. And so actually naming a thing. And so teaching your loved one what's the actual term if they happen to have a chronic condition, but also going the step further of teaching them what are the medical conditions of their genetics within their family of origin. And so knowing their family history is also going to be important, whether they're, once again, not sick at all. But sometimes students come here and start to present with symptoms. And so from a health literacy standpoint, teaching them about themselves and about their family of origin is very important when we're trying to do a history. The second thing, and I know it may sound simple, is teaching them how to make an appointment. It is often assumed that from them listening and watching you, that they know how to call and make an appointment, and also to know what to say, but to actually be able to call and say that I'm seeking an appointment for XY reason, and also how to help them to navigate medical platforms, because we do have our own also with our student health center, and how to have a conversation with their medical providers and also nurses. What do you typically say in a doctor's appointment? How do you communicate your symptoms? And how do you once again advocate for yourself? And then as we get to the health literacy terms, really understanding at least some of the basics of copay, co-insurance, deductible, and also how to read their insurance cards. There are many simple tutorials that are already out there that's online that you can just do a simple Google search of saying how to read an insurance card that will teach you the terms and also how to read the insurance card. But also once your loved one gets here, starting January the 1st in the spring, we will actually be able to have a health literacy program that will be available for all students that will actually take them through a health literacy and financial literacy program. And so we will be able to share that out for all students.
Thanks, Dr. Watkins, for all of that. Some exciting education that's coming out for students that hopefully can help them to build some of those skills. Jillian or Mark, do you have anything to add there?
As
It was a
usual,
wonderful
Dr. Watkins was perfect.
Yeah, I was gonna say, how do you add on to that? Well, just looking through our Q&A, we do have just one final question in the Q&A. But if anyone has a kind of a lingering thought, please put that in. And then we can wrap up with our presenters with some final thoughts. But there is another question here from one of our participants today asking if possibly, especially for Mark and Jillian, if you could restate maybe the way you prioritize students at the Student Health Center. What it kind of sounded like is that for students with private insurance, that they can access the health center, but maybe not with like a priority status. Could you help to kind of clarify that, or maybe restate kind of what was in the presentation?
Yeah, so all of our students are a top priority to us. So if you are an enrolled student at the University of Utah, paying your student fees, you have access to the health center. We do not create a priority system based on what health insurance you have. The reason that I talked about the health insurance is so that you know from a financial perspective what to expect. So if you are calling and making an appointment, any student who calls at the University of Utah to the Student Health Center will have equal access to our appointments. You will just maybe have different coverage based on your insurance. So if you have the student health insurance plan, or if you have Wellfleet through Utah Global, this is where you want to go. If you have private insurance, we are still happy to see you. We have discounted rates, so you'd be paying less than you would be paying out of pocket elsewhere, most likely, but we will not be able to bill your insurance, and your insurance would not cover your visit. So that is the only thing. It is a personal decision whether or not you still want to come here. It's based on your own financial needs and your health needs, but we do not prioritize student health insurance patients over any private insurance patients. We just prioritize University of Utah students. So if you're a student, we're happy to see you.
I'm muted. Thanks, Jillian, for that answer.
Yep.
Dr. Fitzner, do you have anything else that you'd like to add with that question?
Other than the fact that I think our receptionists are very good about asking if they have other insurance, and will help try to steer them toward the correct, from what they know, though insurances change all the time. So it's always, as Jillian has mentioned, best to check. And I think there was a question I noticed in the Q&A about whether Kaiser uses Cigna, and does that work for Intermountain? And the best response is to go onto Kaiser's website and see who your in-network provider is in the Valley, and that'll direct you best to the urgent care that meets your needs.
Wonderful. Let me just check real quick. I'm not seeing any additional questions in the Q&A. Thank you so much, Jillian, Dr. Fitzner, and Dr. Watkins, for just sharing all of this information and knowledge with our attendees today for this webinar. As we're wrapping up, just maybe one final question for the three of you, because this is a really complicated topic, and it's difficult to understand as individuals, but also trying to convey that to our students and to our children is also really challenging. And so maybe just ending with a final question to each of you, of what might be your best advice for our parents, our caregivers, our families who are on this webinar today, who might be watching this later. What might be the best advice you might give to these folks to help them, to help their students to feel most set up for success with healthcare and accessing what they need, especially while they're here at the University of Utah?
The advice I would say is, when in doubt, call. So I mentioned call your insurance, ask what your coverage looks like. If you're not sure about something, call us. You can call the Student Health Center and we're happy to help you. The worst thing you can do is not ask questions and just guess. So if you are unsure about something, you want to know what you should do, call us about your symptoms, call us about where you should be seen. We're going to direct you the best we can. We don't know everyone's plan, so we're not going to guarantee who will and won't provide coverage, but we can at least point you in the right direction. So pick up the phone, give us a call.
I guess I would say as a pediatrician, so I would know that once you start school, it's what I call emerging young adulthood. And so I would encourage you to let your students or your son or daughter make those healthcare decisions and just be there to support them in those decisions. Give them the opportunity to make their decisions and not immediately call you to rely on you for immediate advice. Help them problem solve and learn. And that's what we try to do here as well.
I will piggyback off what Dr. Fitzner said, is really teaching them to recognize the signs when they're unwell. And those will be oftentimes emotional, physical, and even sometimes social, as they're trying to navigate being students, sometimes being students and also being employed. And so oftentimes when we're talking about it from a student health center perspective, even if they're going through emotional and social issues, it may manifest physically. And their first stop will sometimes be in our student health center. And so as Mark shared, just really encouraging them that as they're starting to recognize signs, to utilize what we call help-seeking behaviors, just to seek out help, making that phone call, making that appointment, but also to tell them to go to our student affairs website where we have student health and wellness, because we also have a multitude of resources for all health and wellness needs. And one of our unique programs, just to add a plug as we're wrapping up, is that sometimes students who are newer don't know necessarily where to start. It's one thing that we have a great office of workers, from our front office receptionists to soon to be, we will also have case management in our student health center that can help students with navigation, but sometimes it's not related to student health. And so we also have a peer well-being navigation program for students who oftentimes have questions of, I know that I'm unwell, but I don't know where to start. And so up under Dr. Brittany Badger's office, which is our Center for Campus Wellness, we have our peer well-being navigation program, which can help students to navigate and find where they also should go for all of their health and wellness needs here on campus. And so that would be my plug. Sometimes it's just getting started and getting that encouragement that they may either need from a full-time staff member or from a peer. And so that would be my plug, is to seek out the resources however they see fit. And so they can have agency in their choice. And so I would make that plug for our peer wellbeing navigation program to seek it out as an additional resource.
Wonderful. Thank you so much to all three of you for taking the afternoon to share all this information with our attendees. I see a lot of thank yous in the Q&A if you haven't seen them already. Just as we are ending this webinar, thank you everyone for attending, asking questions, and participating. As a reminder, the full recording will be uploaded to belong.utah.edu. I'm just going to put that in the chat before we go in case you would like that website. But also, if you'd like to learn more about the different health and wellness services and programs that are available to your students, we have a brand new landing page that has all of the information for Dr. Mark Fitzner's office at the Student Health Center, but also a lot of the other health and wellness departments that are here for your students. So I'm going to put that in the chat so you can pull those up if you would like. But please encourage your students to connect with us. We are happy to help them navigate the questions they have in regards to health insurance and health coverage. And with that, we will wrap up the webinar, and just thank you again, everyone, for participating today. So, and thank you to our presenters. Have a great rest of the day, everyone.